For the purpose of unanimous consent request to the gentlelady from New Hampshire, Ms. Shea Porter.
They want me to submit those letters.
Mr. Speaker, I ask unanimous consent to enter to the record a letter from the American Cancer Society which states cancer patients and survivors need affordable, accessible insurance coverage with no pre-existing condition exclusions or annual and lifetime caps, and that high-risk pools have failed to meet these basic needs.
Without objection.
Thank you. Mr. Speaker, I yield 1 minute to the gentlelady from New Hampshire.
Without objection, the gentlelady is recognized for 1 minute.
Thank you, Mr. Speaker. I oppose this cruel bill on behalf of my constituents, especially those that would hurt the most, people with pre-existing conditions, older Americans, veterans, and lower-income people. If this bill passes, we'll go back to the days when people with pre-existing conditions could be denied coverage or charged more, when insurers could decide whether or not to cover basic care like hospitalization, and when sick babies might hit their insurer's lifetime coverage limit before they could even walk. Under this bill, older Americans will pay more. In fact, Americans aged 50 to 64 would pay premiums 5 times higher than others. Veterans will lose access to tax credits that make private coverage affordable, and lower-income people will be hurt. Taking away Medicaid expansion would put affordable coverage out of reach for millions and set us back in the fight against the heroin, fentanyl, and opioid crisis. Instead of this cruel bill, let's come together to improve health care, not take health insurance away from millions just to give tax credits to the wealthiest. We're better than that. I yield back.